This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and your patients. I'm Laura Wooster. This week, ACEP, along with 11 other medical associations, sent a group letter to CMS Administrator Seema Verma responding to a request for information on price transparency that is included in the agency's annual hospital payment regulation. The RFI specifically called out patients being hit with large surprise bills, such as from emergency care. As a group, we believe that it is the responsibility of health insurance companies to provide clear information about medical costs upfront to patients, and that price transparency should not only be the responsibility of providers. In addition to the group letter, ACEP also submitted its own more in-depth comment letter on the RFI, as well as other aspects related to emergency care in the proposed rule. To read both letters, go to the link at the bottom of the screen. Last week, ACEP hosted 3 experts on mental health care and emergency medicine on Capitol Hill to talk about solutions to our nation's psychiatric care problem. Drs. Jay Kaplan, Abhi Mehrotra, and Scott Zeller met with several key members of the House and Senate on Tuesday to discuss innovative approaches to treating patients with emergency mental health conditions. Among the issues they talked about were ED programs supplemented by additional support services and personnel, the Behavioral Health Emergency Room, and the Emergency Psychiatric Assessment Treatment and Healing Unit. These programs all provide access to more timely, appropriate care for emergency psychiatric patients and have been shown to reduce psychiatric boarding times in the ED, as well as hospital inpatient stays.
But the advantage to that is that not only are patients seen by emergency physicians, they're also seen by psychiatrists. They're also cared for by nurses who specialize in behavioral health care. And on top of that, we're able to discharge 40 to 50% of the patients that come into our behavioral health emergency department.
Hoping to be able to take these kind of small trials of change and innovation and expand that beyond our local area, knowing that there will be changes that happen and tweaks based upon resources at each individual site. But there's a menu of options to choose from to implement appropriate care for patients when they're in the emergency department.
We've come up with a couple of, I think, very good ideas that are not only cost effective, but really have much more timely interventions for these people who are in suffering. They're in crisis, and we can help them get better and get home in most cases very quickly, as opposed to just being stuck in the back of an ER.
The House of Representatives wrapped up its work on bills to help address the opioid epidemic. The focus now moves to the Senate, where the specifics on the path forward remain uncertain, though are still promising. Among the bills successfully passed on the House floor this week was ACEP-supported legislation to align a federal law regarding the sharing of substance use disorder and mental health treatment records with HIPAA, ensuring that physicians have appropriate access to patient records while also ensuring strong privacy protections for patients. Also included was H.R. 6, the Support for Patients and Communities Act, a collection of bills serving as the underlying legislative vehicle for most of the opioid bills that now head to the Senate. As a reminder, these include the House-passed Alternatives to Opioids, or ALTO, in the Emergency Department Act, and the Preventing Overdoses While in Emergency Rooms, or POWER Act, that passed thanks to continued ACEP advocacy. ACEP joined other professional medical organizations last week in opposing Department of Homeland Security practices surrounding separation of children from their parents when detained at border crossings in the southwestern United States. While ACEP recognizes the need to secure our nation's borders, the policy of separating children and parents suspected of entering the U.S. unlawfully is cruel and will do great harm to these children. These separations will significantly escalate mental and physical health risks for both children and their parents. As a result of enormous public outcry, President Trump signed an executive order last week ending the child separation policy. Stay tuned for updates. That's ACEP's Capital Minute for the last week of June 2018. I'm Laura Wooster. Thanks for joining me.